This is the presentation for the contact lenses. My topic is the RGP complications and patients management. So, uh, this is the usual complication happen in the RGP lenses. Is 3 and 9 o'clock cornea staining. Okay, so based on this picture, we can see the fluorescence stain at 9 o'clock here. This is the staining. Okay, so on this 3 and 9 o'clock cornea staining, it occurs as an acute band of peripheral cornea between 3 and 5 o'clock and 7 to 9 o'clock. Staining occurs in the area which is not covered by the lens, sometimes referred to as the exposure staining. Then is usually present both nasally and temporarily. So the etiology is an inhibition of blinking, or maybe the patient which is incomplete blinking. So and reduced blinking is the primary causes of the 3 and 9 o'clock cornea staining. Then this leads to disturbance of the tear layer that result in the cornea and conjunctiva desiccation. So okay, the causes, like just now I say, maybe is the cornea staining, and maybe is the incomplete blinking, or the irregularity of the conjunctiva. So let's say it's the pincuscula or pterygium. So this may assist in the breaching of the conjunctiva areas by the upper lid margin. So another causes might be the abnormality of the tear film. So let's say on the tear film got a lot of lipid contamination, mucin deficiency, and maybe the aqueous layer are inadequate. So the symptom of this is the we can base on the slit lamp when we use the fluorescent staining, so we can see malform of the 3 and 9 o'clock staining are asymptomatic. So the greater level of the staining are often bring ocular dryness, itchiness, and increase the level of the redness of the eye. So what is the management on this? So maybe we need to change the RGP lens diameter to larger diameter, so the lens are not easily to move out, and then we can encourage patient to do more blinking, and at the same time we can ask them to apply the artificial tears to moisture their eyes to prevent their eye have the friction with the cornea. And then we need to change the lens fitting. Maybe the lens fitting is too steep, and then we need to minimize the lens surface deposit, so have to clean back the lenses by the lipid cleaner and the protein enzyme. So the another one is cornea Dellen. So the cornea Dellen are the dimple or saucer-like excavations at the cornea margin. They are usually elliptical in shape and parallel to the limbus. So we can see this one. So this is the cornea Dellen. So the symptom of cornea Dellen usually come with the redness, then foreign body sensation, so the patient eye will gonna discomfort, then grittiness, they feel something there. So the sign is depressed region with clearly defined margin. Then it would be 2 to 3 mm in diameter. Then commonly is at the temporal side, forming ellipse parallel to the limbus. So like just now at the photo there, the corneal wall is steep, limbal wall is sloping. Then base of lesion appears hazy and dry, like just now we can see the photo. You can see the photo. Okay, it's okay. Epithelium is usually intact overlying a thin area of dehydrated stroma. Fluorescent pools in the depression are overlying staining. Okay, so the etiology is the formation is secondary to localized breakdown of the tear film of the tear film lipid layer, which followed by corneal surface evaporation and dehydration. So the resulting desiccation produce localized thinning of the underlying tissue, and then continue inability of the upper lid to resurface the mucin layer of the cornea adequately, which is important role in the formation of the process to Dylan formation. So what is the management of the corneal Dylan? So we need to ask the RGP patient to temporarily discontinue wearing the RGP until the cornea are allowed. Usually cornea will be recovered in 72 hours. So at the same time, like just now, the 3 and 9 o'clock cornea staining, we can ask the patient to frequent lubrication the eye by artificial tears and ointment. So another thing, maybe we can use large diameter of bandage contact lenses. So bandage contact lenses is we can find silicone hydrogel material lenses. So we can just put it on our eye to form a bandage to cover our eye, to protect our eye until it cover. Okay, so